I had a brain tumor. So meeting my mortality is nothing new to me. I've had many close calls throughout my life. However, in 2007, that is when I realized that things can change very quickly. I could lose my life, I could lose my wife, my son. My name is Jonathan Pascual. I'm 50 years old. I live in Vallejo, California. I am married to my beautiful wife, Monette, and we have a 22-year-old son who I'm very proud of. His name is Iona. I am a lung transplant nurse practitioner in the University of California, San Francisco Medical Center. As far as what I love to do, I love to be outdoors, swimming, biking, and running. In 2021, while I was training for the Ironman World Championships for Kona in 2022, I started having shortness of breath. It could just be a mile run and I would be hands on knees and I would feel short of breath. This was in the later parts of 2021. Come January and February, I've noticed other symptoms like facial swelling, neck swelling, and neck vein distension. When I go swimming, I was so short of breath and my neck veins were just popping out like ropes. Come March, this really concerned me that even though I was running 22 miles and I was getting fitter and getting leaner and dropping my weight to the 150s, but my face was just swollen when I wake up in the morning. And whenever I rise from a sitting position or lying position, I would get dizzy. And it happened that once I stood up fast, started walking, and my vision just blacked out. And I just hit the ground just like a log. And that happened a couple of times. And to me, I, of course, said, okay, I knew something was wrong already, but the syncopal or fainting episodes became very concerning. And that's why I went to UCSF Medical Center. I was in the emergency room of UCSF, and I already had contact with my colleagues there because I thought, okay, it could be my heart. I'd like to have an echocardiogram. I'd like to have an x-ray. But of course, I knew those things were coming as part of the workup in the emergency room. And when I actually looked at my x-ray on my phone, since I have access to my files, I saw that the mediastinum, which is that part in the x-ray, which is at the middle of your chest, and it contains the heart and the big vessels. And when I saw that, it was quite wide, which is an abnormal finding. So I knew that a CT scan was coming. And when I actually looked at that CT scan and that x-ray, I knew right away that I had cancer. There were other things that were going through my mind that, the whiteness on the upper part of the lung area could be infection, but I don't feel like I have an infection going on. So could it be something wrong with the great vessels of my heart, like in the aorta? But then when you see images like that, 90% of the time, it's due to a malignancy. So it was still pretty surreal to hear the emergency room doctor tell me that more than likely this is cancer, which pretty much confirmed what I thought when I diagnosed myself with cancer. I was admitted that day to undergo many different types of exams. And of course, there's a lot of blood work involved in that. And my echocardiogram, by the way, was actually okay. There was just a trace mitral regurgitation, which I wasn't too concerned about. But we knew that we needed a biopsy to see what this mass is, which is right near my chest. And the tumor itself was actually extending into my neck. And we saw in the scans that it has spread to the lymph nodes in my chest. It has spread to the lungs, and I had full body scans, and it's pretty much spread throughout my bones, from my skull, throughout my spine, my sternum, my ribs, even my arms, my leg bones, my pelvis, and the sacrum. It's throughout. Now, we wanted to know what kind of cancer this is, and with the biopsy, the diagnosis came as mediastinal paraganglioma. And because of the spread, this is stage 4. In 2007, I had a brain tumor. So meeting my mortality is nothing new to me. I've had many close calls throughout my life. However, in 2007, that is when I realized that things can change very quickly. I could lose my life, I could lose my wife, my son. And that is when I started looking into the philosophy of Stoicism. So, in essence, I started looking at life wherein you can lose it anytime. And I started looking at death not in a morbid way, but in a way that I can live my life with meaning and purpose, and to be ready with anything that comes. So, upon hearing the diagnosis that I have stage 4 cancer, I initially switched to clinician mode. I thought of this as a problem and came up with a lot of questions, like what is the next step? What kind of diagnostics do we still need to get? Do I need genetic testing? Because I'm concerned about my son. And I also thought about what kind of therapy is available for this type of cancer. And looking into it at that time, I found out that this is the rarest among rare cancers. Paraganglioma essentially is so rare that you will probably have 2 to 6 people out of 1 million people who will have this. The genetic testing did not really show that I have von Hippel-Lindau syndrome, because I did have that tumor in the past in my brain. And then I have this new tumor, which is actually a separate type of cancer because it is derived from neural cells versus the hemangioblastoma, which I had in 2007. So what came out of the genetic testing was that I did not have von Hippel-Lindau syndrome, so that would affect the type of treatment that I would get. And it actually gave us a sigh of relief as far as my son being affected by the same cancer. The treatment that I had for my mediastinal paraganglioma focused first on this big tumor that is about 9 centimeters wide near my heart. It was actually compressing on the superior vena cava, and that's why I have what's called superior vena cava syndrome. So when you are treating somebody like me who presents with all of this fainting episodes, neck swelling, those, and then my neck being involved, it can affect my airway. So that is the main focus, is to reduce the size of that tumor. So initially I had external beam radiation therapy. So high powered x-rays were used to shrink that tumor. So I went through a lot of radiation. I maintained my activities through my radiation treatment, even if it's just, I could hardly get out of bed. I would go for a walk. And then at other times I'd be more uh, high energy and I would go for hikes. Because the cancer is so widespread, you would think, okay, what about the other tumors in my body, like in my lungs, in my lymph nodes, and throughout my bones? What kind of treatment are we going to do for that? I would have this treatment every 8 weeks for this targeted therapy. And with subsequent scans over time, this tumor actually was reduced to about 6 centimeters. My symptoms did improve, and the other cancers throughout my bones were stable, meaning they did not grow, and the other organs in my body did not have any cancers. So the goal of targeted therapy in my case for stage 4 cancer is stability. Another way of putting that is it's essentially palliative care. There's no cure for this. We can only reduce the tumor size and relieve me of my symptoms. And I believe that during that, from 2022 all the way to 2023, while I was getting treatment, that we were successful in achieving these goals. However, there were other things that did happen, such as because I have all these tumors in my spine, that I fractured my lumbar vertebra, and that was really painful because the nerves get compressed, and when you've got compressed nerves and things like those, they are debilitating pain. So I had to go through surgery to put cement to stabilize those bones. And then after that surgery, I went through radiation again to kill the cancers in that specific lumbar vertebra. The last treatment that I received was January of 2023 for the targeted therapy. Um, and during that time, I knew that I was feeling better as far as symptoms. So I bet on myself and I said, I'm going to keep training. So in 2023, I did at least 10 races. I started to train, and I did marathons, ultra marathons, and triathlons. And when I went back to Ironman Kona just to watch, I thought maybe I have a chance to um, compete in the World Championship, because you have to earn your spot to get to the World Championship, which I already did. And since I received that treatment January 2023, I knew that I was not going to have any more side effects. So, to make a long story short, I reached that pinnacle of my triathlon career. I finished Ironman Kona, which is, the zenith of most of us triathletes in our triathlon career, only to crash at year's end. By December, I was symptomatic again. My face was blowing up again, and my arm was swelling up. And I got treated for that with lysis of the clots, and I'm now on blood thinners. Good morning, everyone. It's 7 days now of being here in the hospital, but at least I am out of the intensive care. I went through a procedure to dissolve the clots that has been giving me a lot of symptoms. However, even though it did work, all of those symptoms came back. The facial swelling, all the neck veins, you can actually some of it like popping out over here, the facial fullness, the difficulty of kind of like coordinating my swallowing and breathing. I feel like when I swallow something, somebody's hand is around my neck. I get dizzy when I get up. Even minor activities, I feel like I'm having a difficult time breathing. I told myself that you gotta have a fit mind and body, because training is not merely for racing. Training is for something when life hits you hard. You can get sick. There are maybe non-physical assaults to your persona, your mental, emotional. There could be injustices in the world, but you gotta be steeling yourself for all of these things. So I believe I am the best person to judge like what I can do as far as my activities. So I have a garage gym. I lift weights. I ride my bike. I have a treadmill there. But all of this are very measured. I watch my heart rate, and I know how high that can go, because if I push it too hard, I will faint. And now because I have developed those clots, it's especially important that I be careful, because if I faint and I hit something, I hit my head, I could have a massive bleed. So people can say, oh, why is this guy still doing Ironman and has already got a terminal diagnosis? And I think it's a matter of outlook, of perspective. We're only given a certain period of time in this world, and it's up to us how to decide on how to live that time. And to me, uh, the most important things now are that I'm spending time with my wife and my son. I actually went back to work in lung transplantation because that's a big part of my purpose, that I am helping save people's lives. And I am still moving, and I may not be racing anymore. Who knows? But you never say no. Uh, I may get better and be able to run again, but I can definitely ride. But it's really very important that I continue the things that I love to do, because it's not just me moving in nature. It is me spending time with my friends who love going out on the trails or going out in cold San Francisco Bay swimming and and all those things. Stage 4 cancer is not a death sentence. It is an invitation for people to truly find out what true courage is, what true resilience is, and what true strength is. Stage 4 cancer is something that you can live with, that it can be managed like a chronic illness. And that's what I want people to know. And it allowed me to actually see what are the really important parts of my life that I would love to continue and what kind of difference I can make. And part of that is talking to young people in high schools, telling them about my cancer journey and talking to them about my athletic career, and to not be afraid of um, asking questions as they have issues with their bodies or as far as symptoms. And this is not just for young people, that it's very important to know their family history as far as if they've had, parents, grandparents who've had cancer, because, we are now in an age where being able to diagnose disease early, cancer early, it can make a difference as far as your living. You can have a good quality of life like I do. People wrote me off like, oh, stage 4 is terminal, is going to be gone. Well, I don't think so. I think that notion is false. I think that's a myth. I think you can do so much. You are still able to give something of yourself. And one of the things that I believe that really put me in this position was that I was able to give to myself first, be kind to myself, forgive myself for all my trespasses. And then from there, I was able to give more to my community. And it's not just the running or triathlon community. I think it became much more widespread when people saw me cross the finish line in Kona. I think it is a wonderful place to be in, to be the patient and clinician at the same time. Mind you, this is my own personal story, such that I can talk to my lung transplant patients, and if they find out or when they find out what I'm going through, I believe that we have this type of maybe connection. I don't know, have the word for it, that we both face our mortality and we both realize how important life is, and we can get rid of all the fluff and focus on what really matters to us. And as far as a clinician, I believe it has helped me to be more of a collaborator in my own treatment plans, because I know what kind of tests, the interpretation of those tests, I know what kind of questions to ask. And in fact, I hear a lot of people say, as a patient and as a clinician, you have to be an advocate for yourself in our, healthcare system. You got to push for this, you got to push for that. It's good for you to ask questions, and there's really no, let's say, wrong questions. And we're not all clinicians, right? It's good to ask for what are second opinions, what are other doctors think about this approach, and things like those. So to me, I know where I'm at in my 5-year prognosis. I'm going to my 3rd year of having this cancer, and now I am having worsening symptoms. People go through what they call scanxiety, and they go through scans and they said, is the cancer back? Well, I'm not in that position. The cancer will always be there. And the question is it worse, or are there new cancers? And that tells me the trajectory of my disease and what possible steps are going to be next as far as treatment. So I think it helps. It helps being a clinician. And some of my friends think that, oh my gosh, it must be terrifying to know what's going on in your body. I said, no, it actually helps me to be accepting of what's going on. One of the things that I have been able to do since this cancer diagnosis is fundraise for a nonprofit organization to raise money for people and their families who are going through the cancer journey. And the event that I host, which will now be on its 3rd year this September, the last week of September, is called JP's Backyard Ultra. So it's an ultra marathon. However, everyone is actually welcome. So it's a 3-mile loop in Skyline Wilderness Park in Napa, wherein you go through trails. There are some uphills, downhills, rocky sections, and everyone starts at the hour, every hour. So it doesn't matter if you're a fast runner or you're a veteran ultramarathoner or you're going for your first marathon or your first 10K. Everyone goes at the same time and then rests. And we were able to raise for the last 2 years anywhere from, I believe, 10,000 to the first year to like 14,000 in that one day. And this goes for the last 2 years. The nonprofit that I have selected is the FC Foundation. And I would like to continue doing that as long as I'm healthy. And it's gotten bigger. and I'm a one-person team with a couple of people helping me. And now this is so enormous. It takes so much of my time and my own money to hold this fundraiser that it's so daunting that I believe I need to form a group to hold this event in order to raise more funds for cancer. Going through this cancer journey, I came to this realization in the first few days that I was in the hospital in March 2022, that I have to live the rest of my life with gratitude, meaning, acceptance, compassion, and forgiveness. So when I said this to the chaplain who visited me, he affirmed that I was coming from a place of love. So to me, giving is very important. And you have seen that as far as my life's work. I chose the service profession. To me, the message that I want to give is be a force for good. And you can start with simple things as being kind to yourself, forgiving of yourself, being compassionate to yourself. And from there, that can extend outwards as far as giving to others. I talk to young people in high schools and We live in a society where you are forced to or asked to excel in many things, academically, athletically. But I believe you can be a force for good from starting within yourself and being a good son or daughter, be the best friend, be the kindest person in the room. Simple things like that. So be a force for good. And to me, that is the challenge that I pose to you. Find out what you can do for others.